Your feet. Aside from when you put your shoes on every morning, you might not think much of them at all. Actually, though, feet are far more important than we give them credit for. They help us to get around with very little complaining, and they adapt to different terrain so that we can easily walk, run, or stand in every location. Feet aren't only good for walking, they help your whole body to regulate optimum temperature, and reflexology professionals believe that they can improve functioning of the organs by treating the feet alone. Most importantly of all, when problems occur, your feet could be trying to tell you more than you might think. Several of the most common foot problems can often reveal signs of a more serious health problem that's worth checking out. In this video, I will show you what foot problems reveal about your health. Number 1. Cold feet. If you're always complaining about cold feet, then you might be suffering with more than just a chronic chill. Cold feet can be a sign of high blood pressure or heart disease. Studies have also linked smoking with cold feet, and the nerve damage caused by diabetes may lead to a lack of blood flow to feet and ankles. Number 2. Swelling of feet. It's pretty normal to experience swollen feet every now and then. People commonly experience symptoms when they've been standing for long periods of time, exercised heavily, or spent time on an airplane. The problem, however, is when foot swelling does not reduce after several hours or is a permanent occurrence. Swollen feet in the long run might be a sign of poor circulation, which is often a sign of medical conditions like kidney disorders, underactive thyroids, or problems with the lymphatic system. Number 3. Foot pain. If you're finding yourself ending the day with aching feet, you might be suffering from more than just soreness from a long day of standing up. Recurring, persistent pain in a certain part of your foot or ankle might be a sign that you've got a stress fracture or one or several small breaks in the bone. Stress fractures are more easily caused than people think. Intense, high-impact exercises like running, circuit training, and team sports can cause stress fractures, as can weakened bones due to osteoporosis. Number 4. Clubbed toes. Clubbed toes refers to when the shape of the toes, and sometimes the nails, changes noticeably. If you're showing symptoms of clubbed toes, you might notice that your nails have rounded out at their tips and are pointing more downwards towards the floor. While clubbed toes may not be a sign of anything serious, they could also be linked to an underlying cause, such as lung, heart, and liver disease, as well as digestive issues and infections. Number 5. Dark spots on the feet. If you're thinking, who would get skin cancer on their feet? You'd be right to be cautious. Skin cancer is usually associated with sun worshippers who spend hours lying flat out on a deck chair. But the truth is, it can affect anyone and any part of the body. It's always worth checking your feet for darkened moles that are irregular in shape, itchy, or bleeding, especially if they appear randomly and suddenly. Melanoma beneath the nail may show up as a dark spot that is less visible than a mole. Number 6. Dragging your feet. We've all dragged our feet from time to time, whether from tiredness, silliness, or generally for no reason at all. If dragging your feet is something you notice you do often, though, it may actually be a sign that something isn't right with your health. You might not even be aware that your feet have slightly lost sensation, which is usually caused by nerve damage linked to diabetes. This nerve damage may also be related to infection or vitamin deficiency, so get it checked out by a doctor for an accurate diagnosis. Number 7. Painful sores that don't heal. Experiencing any sort of injury that draws blood is hardly pleasant. But what's even worse is when that injury won't heal, seemingly ever. If you've got a sore that keeps reopening without aggravation, you might be in danger of having diabetes. We know already that diabetes can impair sensation in the feet, and it can also prevent wounds from healing at a normal rate, which can lead to further issues like infection. Diabetes aside, a wound that doesn't heal may also be linked to peripheral artery disease, which causes poor circulation to the hands and feet. Number 8. Heel pain. Repeated heel pain might not be something worth ignoring. It could be a sign that you have a deeper issue that needs fixing. Plantar fasciitis is a common inflammation that's caused by a number of factors, including arthritis, ill-fitting shoes, tendinitis, high-impact exercise, and anything else that may put unnecessary pressure on the heel. If you're struggling to put your full weight on your feet without heel pain, especially in the mornings, it may be a sign you're experiencing plantar fasciitis. Number 9, foot spasms. Foot cramp is one of the most uncomfortable, sometimes even agonizing experiences that can leave you hopping around begging for relief. Luckily, usually you will experience relief from foot cramp after a few minutes. But if you're getting cramp in the same place far more often than you used to, it might be a good idea to look into the issue. Sometimes, cramp is just caused by overwork, leading to muscle fatigue. However, it can also be a sign of dehydration, poor circulation, or imbalances in vitamins such as potassium, magnesium, or calcium in the body. Number 10, discolored toes. Cold feet that turn white, then deep blue, then red may be a sign of Raynaud's disease, caused when arteries narrow suddenly, creating vasospasms. These spasms can be caused by changes in temperature, such as going from warm to very cold. Stress can also cause vasospasms, although less frequently. Raynaud's can be related to other issues, so contact your doctor if you're showing symptoms of the disease. Number 11, claw toes. We all had the warning from our parents when we were younger. You can't wear shoes that are too small for you or you'll get crooked toes. While this is true to some extent, claw toes might also be caused by disorders that prevent proper nerve sensation in the feet. Diabetes and other neurological issues can all result in claw toes, as well as alcoholism. Claw toes are characterized by an upwards bend from the ball of the foot to the middle joint, and a sharp downwards bend from the middle joint to the tip of the toe. Number 12, burning sensation in feet. A hot, burning sensation in your feet is rarely ever a good sign, and it's important not to shrug it off as nothing. Usually, if you're experiencing a burning sensation, it's because of peripheral nerve damage, which is a common symptom of diabetes. Less seriously, a burning sensation can be caused by a deficiency in vitamin B or athlete's foot. Sometimes chronic kidney disease can also lead to an uncomfortably hot feeling in the feet. Number 13, itchy feet and toes. Ever experienced that horrible between the toe itch that you can only resolve by removing your socks and shoes and scratching for all it's worth? It sounds unpleasant, but we all know the feeling. And even worse, the itching never seems to stop. Constant itching, accompanied by redness and soreness, might be a sign that you've contracted athlete's foot, which is the most common, easily spreadable fungal infection that can affect a person of any age. Another less likely cause is contact dermatitis, which is a reaction of the skin to chemical-heavy skincare products. Number 14, big toe pain. Random big toe pain might simply be a sign that you've outgrown your shoes. But if the feeling persists when you've bought a new pair, it could be time to seek medical assistance. Gout, a common issue in older men and women, is a common cause of joint pain in the toes, especially in the big toe. Another common problem, osteoarthritis, can lead to joint pain all over the feet, as well as noticeable swelling. Less likely is an issue called turf toe, which can often cause issues for athletes. Number 15, pain in all toes. The smaller toes especially might experience pain if you have a disease called Morton's neuroma. This causes an odd and uncomfortable sensation in the smaller toes and the ball of your foot, with sharp pain radiating through the area. Morton's neuroma is characterized by a thickening of the tissue surrounding a nerve and normally occurs between the third and fourth toe. Its cause is normally specific to a person's own situation, but can be linked to stress or injury of the toes. To conclude, It's surprising to consider just how important our feet are, not only in helping us to seamlessly go about our daily lives, but also in letting us know when something's not right. Feet actually say a lot about our general health condition, and their connection to all of the body's internal organs means they're always ready to display warning signs at the right times. Reflexologists believe that the body is mapped on the feet, and the professionals in the field will usually examine the feet to determine whether a patient is experiencing any internal issues that they may not be aware of. It's pretty astonishing to learn just how much a person's feet can reveal about their overall health. Feet are definitely worth a little more credit than we generally give them. I hope you enjoyed this video on what foot problems reveal about your health. If you have, please subscribe to this YouTube channel, and don't forget to give this video the thumbs up. And I'm sure you're going to enjoy this next video on foot health conditions. Thanks for watching, and bye for now.